What would happen if suddenly, magically, men could menstruate and women could not? In a 1978 article for Miss Magazine, feminist pioneer Gloria Steinem answered this question that so many women have asked. She said, menstruation would become an enviable, post worthy, masculine event. Men would brag about how long and how much. We'd have Paul Newman tampons and Muhammad Ali's rope-a-dope pads. More than 40 years later, nothing seems to have changed. Menstruation is still a serious global challenge, both physically and emotionally. According to a 2015 report from UNICEF and the World Health Organization, at least 500 million girls and women globally lack adequate facilities for managing their periods. In rural India, menstruating girls face long standing social stigmas and often become isolated from family, friends, and their communities. 1 in 5 girls drops out of school after she reaches puberty and thus falls behind her male counterparts. UNICEF Menstrual Hygiene Management reported that in South Asia, 87% of women and girls are completely unaware about menstruation and do not have any knowledge about the purpose of menstruation as a biological process. Another study revealed that 1 out of 3 girls in the region knew nothing about menstruation prior to getting it, while 48% of girls in Iran and 10% of girls in India believe that menstruation is a disease. Women's capacity to manage their periods is affected by a number of factors. Limited access to affordable sanitary materials and hygienic disposal options leaves many to manage their periods in ineffective, uncomfortable, and unhygienic ways. These problems are further exacerbated by insufficient access to safe and private toilets and lack of clean water and soap for personal hygiene. In some contexts, natural materials such as mud, leaves, dung, or even animal skins are used to manage the menstrual flow. Surprisingly, menstruation is managed no better in developed nations. For example, tampons and sanitary pads are taxed in at least 40 states in the United States, while adult diapers and Viagra are not. When the US President Barack Obama was asked about this luxury tax on tampons, he was stunned and accepted that he had no idea why states were imposing this tax. He suspected that it was because men were making laws when those taxes were passed. It was shocking that even the president didn't know about something that affects people every single day. That's a sad reflection of how women's issues are viewed even today by governments and societies.
Inadequate menstrual hygiene is a global concern that needs to be addressed, and it's time we start talking about it. There is a pressing need to educate not only women, but also men that periods are a sign of good health and not a disease that needs to be looked down upon. In order to solve this global issue and to remove the stigma attached with it, innovative and integrated leadership solutions such as self-organized learning environments, as suggested by pioneer educational scientist Sukata Mitra, need to be implemented. Under such models, several female volunteers from all walks of life who can dedicate as little as a couple of hours a week can be appointed across regions, societies, and communities. These civic health leaders can be trained and empowered to act as disseminators of feminine health and well-being. They can also be suppliers of free sanitary materials to all those who cannot afford them. In the long run, these leaders can also train other wealthy women to take up such roles and set a global human supply chain of health, education, and sanitary resources. This integrated leadership model will provide a twofold solution to the problem of menstrual hygiene. First, by appraising people of this biological process, and second, by providing the requisite resources and infrastructure. An important way of taking this empowering model forward is by collaborating with global organizations such as the WHO and UNICEF to take this initiative to the remotest corners of the world.